Hi, I will be discussing 5 topics for my week 6 video, and these include physical activity and cardiovascular disease, defining and measuring fitness, cardiorespiratory fitness and cardiovascular risk, muscle physiology, and how fitness reduces risk. Physical activity and cardiovascular diseases. Now, the findings between physical activity and cardiovascular disease risk can be explained by first describing the kind of studies done. These were primarily systematic reviews of prospective cohort studies, and activity was mostly measured using leisure time, household activities, occupation, and commuting activities, with most assessing primarily leisure and physical activity. Cardiovascular disease was measured using cardiovascular heart disease, cerebrovascular diseases, and cardiovascular health. The magnitude of effect of cardiovascular disease um, amongst men changed mostly between with a median risk reduction in men of about 30%. This a particular study that is noteworthy was the Shiroma study, which showed that there was a median risk reduction of about 30% amongst men, and most active men compared to least active men was how that was measured, to bring that result. And the different studies used varied questionnaires for accessing physical activity and different categorizations. The current guideline for physical activity is to have at least 150 minutes per week of moderate intensity exercise, or 75 minutes per week of vigorous intensity physical activity. However, this may not be, completely required, and usually about 15 minutes of exercise every day is pretty much acceptable for a good level or good amount of physical activity. Defining and measuring fitness. Cardiorespiratory fitness compared to physical activity is measured in a lab, and that's carried out by measuring the maximum oxygen intake during intense exercise. However, physical activity is self-reported and its measurement is highly subjective. Um, Given the age of an individual, to measure the maximum heart rate as well as target heart rate, for a 20-year-old, the target heart rate should be 100 to 170 beats per minute, while the maximum heart rate should be 200. To explain what a MET is, MET means metabolic equivalent, and a MET is defined as the oxygen intake of an individual at rest, sitting down, and it's given by 3.5 mils of oxygen per kg per minute. The a poor MET value for a 50-year-old male would be 8, while for a female would be 6. And factors that affect or influence cardiorespiratory fitness include age, physical activity levels, gender, comorbidities like hypertension, diabetes, as well as altitude and temperatures surrounding an individual. To describe the effect of genetics on an individual's fitness level, looking at the heritage study carried out amongst families, it was discovered that there was 2 times more variance between families than within families. And so it could be deducted that almost or at least about 50% of an individual's fitness level is affected by genetics. Cardiorespiratory fitness and cardiovascular disease risk. Like I described earlier, a MET increase is just an estimate of how much an individual is taking in oxygen at rest. And so, an increase in MET means that an individual is taking more oxygen, which is equivalent to an increase in fitness level. And so, in the aerobics center longitudinal study, um, low fitness level was considered to be 0.72 for men, while 0.63 was for women. The biggest decrease in the risk of cardiovascular disease occurred between the least level of fitness to the next level of fitness. And so, if I was to react to the statement that says that mortality may be less for those who are fit, but not for those who are not fit now, however, are trying to get fit, I would say that any little effort towards fitness is going to add some benefits to reducing mortality. So, if an individual was never fit but is trying to get fit, I believe that mortality reduction is very possible with any increase in fitness level. And so, how much exercise is needed to see beneficial effects and reductions in mortality? I would say that moderate to intense physical activity would reduce all kinds of mortality causes. However, at least 15 minutes of exercise daily um, should be very beneficial to reducing cardiovascular risk. And that's half of the recommended amount of exercise that an individual should be taking. Muscle physiology. I will be answering questions and filling in the gaps. So, when the nerve impulse reaches the axon terminal, it triggers the influx of calcium ions into the axon. Number two, influx of calcium ions into the axon causes synaptic vesicles to release acetylcholine via exocytosis, which then diffuses across the synaptic junction. Number three, when acetylcholine binds to the acetylcholine receptors on the sarcolemma, it opens voltage-gated channels which allow in sodium ions. Number four, when sodium rushes across the sarcolemma, the change along the inner membrane becomes depolarized. When depolarization reaches a certain threshold, the action potential propagates along the sarcolemma. The next set of questions, number one, an action potential is conducted into the interior of muscle fibers via an unfolding of the sarcolemma known as the T-tubule. Number two, the calcium storing membranous network inside a muscle cell is called a sarcoplasmic reticulum. Number three, when activated, voltage-gated proteins connecting the T-tubule and the sarcoplasmic reticulum causes the release of calcium from the sarcoplasmic reticulum. Number four, release of the enzyme acetylcholinesterase in the neuromuscular junction destroys acetylcholine and stops the generation of a muscle action potential. The next set of questions are number one, the muscle unit of contraction is called a sarcomere. Number two, in terms of filament thickness, actin is the thin and the myosin is the thick filament. Number three, the first step in sarcomere contraction is when calcium binds to troponin. Number four, Activating the myosin head occurs when ATP is hydrolyzed. Number 5, the power stroke occurs as ATP is released and the myosin head bends Number 6, binding of ATP to the myosin head causes a detachment of the myosin head from actin binding. By the way of a deficiency of ATP in dead causes rigor mortis, which is failure of myosin to reset. Number 7, to end contraction, calcium returns to the sarcoplasmic reticulum. How fitness reduces risk. I will start by defining endothelial shear stress, which is the tangential force exerted on the endothelial surface by flowing blood. And so a low ESS is considered a good thing, also known as oscillating endothelial shear stress, which usually occurs around inner areas of curvatures as well as areas of upstream of stenosis. Three ways in which the endothelial cells identify shear stress include the use of PKAM1, which is a member of the immunoglobulin superfamily, as well as the glycocalyx on the cell surface, which contains glucosaminoglycans like paransulfate, as well as vascular endothelial cadherins. The role of enos in endothelial cells include donation of oxygen to form superoxide anions, which is a reactive oxygen species, and it helps in reducing the bioavailability of nitrous oxide. There are beneficial effects on increased nitrous oxide production, which includes the delivery of oxygen and nutrients to tissues while simultaneously reducing blood pressure. It also exerts an inhibitory effect on inflammatory processes like aggregation of platelets and migration of leukocytes. It also prevents proliferation of smooth muscles. A low endothelial shear stress has multiple important physiological effects like oxidation of LDL, as well as promoting production of reactive oxygen species into the intima, as well as reducing the bioavailability of nitrous oxide, therefore reducing mRNA for eNOS. For something new, I will be discussing a study that was done in the University of Alberta in Canada about physical activity following pregnancy in women who are at risk of cardiovascular diseases. And so 47 women were recruited, 25 which had preeclampsia during their pregnancy, and 22 who had normal pregnancy. And so they were all enrolled in 6 to 12 months of exercise program. And following 12 weeks of training, both groups had significant improvement in cardiovascular disease risk factors. And their vascular endothelial health remained lower in previously preeclamptic pregnant women, and improvements in other risk factors were only achieved like similar to the women with normal pregnancy. And the study confirmed that the benefits of exercising reduces the traditional and non-traditional markers of cardiovascular risk. And also, the study demonstrated that exercise is an important intervention to reduce cardiovascular disease risk following preeclampsia in pregnant women. So, in conclusion, physical activity is a very important factor in promoting good health, especially cardiovascular health. And I believe that, especially in young people, exercise and physical activity and fitness should be the mainstay of maintaining good health.